Auto insurance can all seem the same until it comes time to use it. So don't get stuck paying more for less coverage. Switch to USAA Auto Insurance and you could start saving money in no time. Get a quote today. Restrictions apply.
USAA.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
What did the tree say to the moss? You're starting to grow on me.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on the show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. All right, very good. Don't forget stuff.drsteve.com for all your shopping needs. And on there you can see the Rode robotic guitar tuner. If you have a friend that you need to buy something for their birthday or anniversary or just because you care about them, go there to stuff.drsteve.com and scroll down and look at the Rode and buy them one. It's the most incredible thing, and it's not that expensive. It looks like it would be $300-400, and
easily.
Yeah, they're under. I think they're like under 150. So somewhere in there. And they have one for bass guitar too. And I actually used mine to because I hate winding the dang strings, and it'll wind your guitar when you're putting new strings on it as well. It's pretty dang cool. Mm-hmm. And you can have different tunings. You can tune to open G or just any damn if you want a random one that you've got. Mm-hmm. If you've got Robert Fripp's new tuning, you can tune to that. There's so many cool things you can do with this thing. So check it out, stuff.drsteve.com, or you can go to Rode, ROADIE, .drsteve.com and see it directly. But you just go to stuff.drsteve.com. Tweakedaudio.com, offer code FLUID. We'll get you the best earbuds for the price, for the money. Best customer service anywhere. And don't forget Dr. Scott's website at simplyherbals.net. Lose weight with me. I have to lose more weight because I'm going to have, it looks like I'm going to have surgery on my back. I'm really trying to avoid it. And thank you to those who have emailed me about this. Yes, I read Dr. Sarno's book. It helped some people that emailed me. I have a structural issue. There's nothing in that book is going to help what I've got. But I think for people who just have garden variety low back pain, absolutely read Dr. Sarno's back pain book. I don't have it on stuff.drsteve.com. Maybe I'll put it on there. But check out Noom, NOOM.drsteve.com. It's not a diet. It is a psychology app. You download it to your phone, and you get a counselor. You get a logging program. It'll track your weight if you have a Withings scale. And if you don't, you just enter it by hand. But I have a scale that tells my Noom how much I weigh, and it tattles on me. But Noom.drsteve.com gets you 2 weeks free, and if you decide to continue it, you get 20% off. And it's only a 3-month program. It's not a on and on and on thing. Matter of fact, you have to tell them you want to have them renew if you want them to renew. They won't do it otherwise. At least that was my experience. May have changed since then, but it's the only thing that allowed me to get this weight off. I was almost at 200 pounds, and I've lost 30, 40 pounds and kept it off. You know?
Awesome. Doing great.
All right, very good. You got anything else? SimplyHerbals.net.
That's it, buddy.
And we plugged Dan Natterman's book last time. That's pretty awesome.
That's cool.
Yeah, I sent my book to Dan to get it autographed.
Autograph,
yeah. I hadn't even finished it yet. I got so excited, I just sent it to him and with a self-addressed stamped envelope.
That's cool.
And it'll be more fun reading it with his autograph. I'm a weirdo.
You are that.
I get out there, I troll for celebrity retweets. I got one from Mary Steenburgen, though.
Oh, cool.
Because I said it was a tragedy that they canceled Last Man Stand. What was it? Last Man on Earth?
Oh, yeah.
With Will Forte.
Yep.
And they ended it on a cliffhanger. And she either retweeted it or liked it. Yeah, I'll take either one.
Yeah.
So people see me just sort of bootlicking celebrities and stuff. It's just basically I collect those. I put them in a folder of favorites. I'll tell you my best one, though, was when David Byrne was on Saturday Night Live with that new group that he's doing things with. Apparently it's on Broadway or something.
Oh, yeah.
And they were playing Once in a Lifetime. And these people with their drums, they're obviously very talented. But they had these big goofy grins on their face, and they're running up to the front of the stage into the camera like we care about them.
No, we don't.
And I just said, is anyone else annoyed by this Glee Club version of Once in a Lifetime? And you know who retweeted it? Was Chris France from the Talking Heads.
Oh, my God.
That was awesome. Don't know how he saw it. He must have been looking around for
oh my God.
People who were complaining about it.
That's funny.
How cool is that?
That's pretty
cool.
cool.
The drummer from Talking Heads retweeted me. So.
I remember that. That was kind of annoying.
It was awful.
Yeah, I thought it was too.
I don't know who likes that. I guess people who don't know the Talking Heads or weren't around in the 70s and early 80s to see them in all of their glory. If you want to see them, go watch Stop Making Sense. Just do that. That movie was definitive. I saw them in concert, and that's what it's like.
The guy's super talented. Great vision.
No flies on David Byrne. I just don't know why he's doing that.
Yeah. Is it his vision or somebody else's
vision? I don't know, but I was really like, what in the hell is this that I'm watching? But maybe I'm just an old curmudgeon and I don't know anything about what's
cool stuff. No, I would buy that.
Because we still, I would like to, quote unquote, smoke a J, quote unquote. But watch out for the quote unquote narcs, man.
That's, coming from a true streaker. That's true.
Anyway, well, listen, I don't know if I have the Stacy DeLoach music. Where in the hell is it? Because it's pissing people off, by the way.
Oh, because it's so terrible?
No, they love it. They can't get it out of their stupid heads, which makes me want to play it that much more. And I don't know why I didn't realize that I don't have it up here. Let me see. Everybody loves this when I do this. Oh, here it is. Okay, I found it. All right. So, in honor of our old buddy, with his too long intro,
You can cut it.
Stacy DeLoach is a good old guy. He's got a lot of thoughts that he pulls from the sky.
True.
He's a cop, he's a captain, he's an entrepreneur.
Can't argue with that.
His questions range from tough to profoundly demure.
True.
Stacy DeLoach, keep on cruising, keep on calling, and keep on keeping on.
Okay, I've had enough.
Hey.
You know what we ought to do, though? Let's do it in the studio, and I'll
Yes.
do some counterpoint, and we'll add some flutes, because I know that's Stacy's favorite.
And you know that
instrument.
was I did that with one.
Yeah, I know.
That
You did your one take, Dr. Scott. I get
Yeah,
it.
that's right. Yeah.
I get it.
Single
All right.
shot.
So anyway, so the reason I'm playing the whole thing is because we need to be nice to him because he's got COVID-19.
Oh no.
Yeah, let's talk to him real quick, and we'll bring him up here. Stacy DeLoach, welcome to Weird Medicine.
Yeah, by the way, I've noticed that you didn't submit your Stacy DeLoach intro song yet, have you?
Well, did you? No, I had one. Did you hear it?
Don't
I
do it,
heard
Stacy.
it.
Don't do it.
Okay, you heard it. Okay. I'm not going to play that one ever again. But we will, Scott and I will collaborate on that one and make it a little more, airworthy.
Yes. Clean.
But anyway,
Alrighty.
so
I
dude,
got it.
so what, if I understand this right, what happened was one of the people that you worked with came down with COVID-19, and so they made you guys isolate, and then somewhere in there you tested positive yourself, and now you're sick AF. So tell us the story.
Yes. I had to go to Mobile, Alabama to go do an accident investigation, maritime accident investigation. Took my compliance guy, IT guy with me. So we're in the truck for about 8 hours driving over, doing the stuff and driving back. And then last Wednesday, a week ago today, we had our managers meeting. President of the company, everybody else were all in there. And my IT guy's there also, my compliance guy. And the next day, which will be Thursday, got a phone call that afternoon from my boss saying, hey, so-and-so tested positive for COVID-19. Everybody's going into a 10-day quarantine.
Okay.
Quarantine at home.
Mm-hmm.
And I'm thinking, instantly I start feeling bad. And I'm thinking, this is psychosomatic. I
Sure.
heard this.
Oh,
I'm involved
every
in
time.
this. So
Totally understand that, yeah.
So Friday morning I got up and I thought, screw this. I'm going to go to the grocery store, but I'm going to do this. Okay, one of you will be mad at me. One of you might appreciate this. I decided I'm going to try to do this naturally. And so...
Do what naturally?
Yeah, well, I decided instead of going out and do it, because when I went Saturday, well, let me back up. So I decided I'm going to go try to fight this thing naturally. And so everybody's telling me you need lots of vitamin C, vitamin D, zinc, blah, 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 blah. So
you broke.
I'm going to go to the grocery store.
So you broke quarantine to do this naturally. I'm just trying to understand.
I hadn't been tested. I
okay.
hadn't tested positive yet.
I got you.
Okay,
Okay, gotcha.
So
But you were
still-
supposed to be in
I'm
quarantine.
still
though.
psychosomatic.
Yeah.
Well, yeah, but nobody else knew this other than people in Baton Rouge.
Well, you knew it. I'm just
200 miles
saying.
away.
Okay, I'm just trying to.
Well, I knew it. What? And so I went to the store and I bought a whole bunch of oranges. I bought corn. I bought everything that was bright. I bought squash. I bought pineapple. I bought bananas. Lots of lemonade.
Okay.
And because, like I said, vitamin C, vitamin D, zinc, and everything else. And then Friday night, I really started feeling it.
Ooh.
I could feel something wasn't quite right. Got up Saturday morning, put on a mask, went to a walk-in clinic, pissed off the nurse so bad. She has no sense of humor. She apparently has never heard of this show.
Well, no, of course not. Nobody's heard of it.
Well, because she goes, you tested positive, and I thought I could be funny, and I went, woohoo! She said, you're not taking this serious.
Oh,
there you go.
No, she didn't understand something very important, that the lay public uses those words differently than they do.
Mm-hmm. Yes.
That pisses me off. You were absolutely right to do what you did, because no one in this profession should be using the words positive and negative for that exact reason. I had I've told this story on the show. I had a colleague whose mother called him and said, oh, thank goodness they called me from the office and said my influenza test was positive. And she thought that meant that it was good. Because you use the word positive.
That was my mother-in-law.
Yeah. You use the word positive for good things out in the real world. So I think what you did, you taught her, she didn't learn anything from it, because she didn't say, oh, yeah, I shouldn't have used that word. She said that she blamed it on you. So anyway, go on. But I think you did the right thing. I'll give you one of these for that.
Give yourself a bill.
Yeah.
There you go. That was. I like it. I think everyone should do that when they tell you your test is positive. You should go, yay!
Awesome.
Yeah. Just to get them to stop doing that.
Right.
Go ahead.
So I come back to the apartment, and I decide I'm getting on regiment. I do best when I have a schedule. Just me psychologically. I'm so used to being a military format and everything else. And so I decide I'm going to sleep for an hour, and I'm getting up and I'm moving for 30 minutes, because I don't want this stuff. I don't want to be flat on my back and let this stuff start building up in my lungs if this is COVID. If it really, really is.
Yeah.
And so I set my alarm clock, my timer for 1 hour. I go to bed, I get up, and for 30 minutes, I'm up moving.
Yeah.
You know, they say I need vitamin D, so I'm going out and walking around the block for 1 hour with my mask on, getting sunshine. I come in, I eat an orange or a banana, and I go to bed for an hour.
Yeah.
And I do that Friday, Saturday night, all day Sunday. I go for a walk. If I don't want to go for a walk, I'll sit down with a ham radio studio. I play on FT8. I mean, nobody else knows what that is. But
yeah, it's a digital mode, but it's fun as hell. Yeah.
And watch Brooklyn Nine-Nine or something like that for 30 minutes, and I go back to bed.
Yeah.
And I do this for, like I said, Saturday night, Sunday. So, and like I said, I'm eating lots of oranges.
Okay. We got it. So let me ask you a question. Why, at this point, you've tested positive. Why not do the monoclonal antibodies? I mean, you were a big Trump guy, right? Your buddy, Mr. Trump got the Regeneron. I mean, he made a big deal out of it.
Allegedly.
No, he did it. Surely to God he did. And Regeneron is a recombinant monoclonal antibody, and it's a combination of two antibodies. And I'm not even going to try to pronounce them because I have trouble with those antibody names, but it's casirivimab and imdevimab. Okay, I did okay. And if they can get it early in people who have risk factors. How old are you?
58.
Okay, so that's not a risk factor, but you are diabetic, right?
Type 2 diabetic.
Yeah.
Have everybody in my family's, except for one, has died from a heart attack.
Okay, but you haven't had a heart
young
attack,
age.
but you are at risk because of your diabetes. Mm-hmm. Okay, so
right.
I'll tell you the risk factors for people out there. Age greater than 65, not Stacy. Obesity, not Stacy. Pregnancy, well, maybe. Chronic kidney disease.
Well, maybe,
Do you have chronic kidney disease? I can't remember.
No.
No, okay, good. So
nope.
Diabetes, there you go. Any immunosuppressive disease, any cardiovascular disease. Do you take high blood pressure medicine?
Nope.
Okay, so but hypertension would be one. Chronic lung disease, sickle cell, any sort of neurodevelopmental disorder, people with, trisomy 21, that kind of stuff, or having any medically related technological dependence, that would be tracheostomy, a gastrostomy, people with feeding tubes, or anybody that uses positive pressure ventilation that's not related to COVID-19, so people on iron lungs and stuff like that. So you would have qualified for this.
You should. Yeah, the nurse practitioner, when she told me I was positive, and then I pissed her off. She told me that I qualified, and I said, I don't think I want to take it.
Okay.
She said, it surprised me. She said, she said she wouldn't take it either.
Well, but we've already established that she was a jerk. So why,
yes.
why would you take what she said in that situation? This combination's been effective in reducing symptoms and keeping them from being admitted to the intensive care unit. So that's why you do it. Now, having said that, you can take your chances. Listen, it's a free country. And obviously, so far, so good, you've done pretty well, right?
I beat it. I mean, by Sunday night, it was gone.
Yeah, okay. Well, you don't sound right, but maybe it's just our phone connection.
Yeah.
But yeah, okay.
I have, by Sunday night, when I woke up after my 1 hour sleep, I had a real nice greasy fart, and I smelled it. It's kind of, since the smell's back, must be over with.
Oh.
And Monday,
that's good.
Monday, I had a little bit of a headache, and that's it. I mean, I haven't gone to get. They told me there was no sense in going to get tested, but I have no signs of anything.
Well, no sense in getting tested now. You already tested positive, so you're down for X number of days according to the CDC's isolation rules. And then if you have no fever,
so is that it?
Do it again.
Yeah, I had no fever throughout the entire thing.
Yeah. So you got to isolate. For, if I remember correctly, it's been a little, they keep changing this. So if I remember correctly, it's 10 days. And at the 10th day, you have to be afebrile, no fever. And, okay, let's see here. Okay, monitor your symptoms.
That'll be next Monday for me.
Yeah, people in isolation should stay home till it's safe for them to be around others. And I'm just looking for a day on here. Last I checked, it was 10 days. So we've had people who were in homes where the family members didn't get it, but they didn't start quarantining until after the person was diagnosed. So they still have to stay at home, whereas the person that had it can go do their thing because they're done with their isolation.
Right.
Yeah, so your local public health authorities make the final decisions on how long quarantine should last, but they usually will go after day 10 without testing or after day 7 after receiving a negative test result. That's for quarantine. And then isolation is used to separate you from people who are not infected. And but anyway, yeah, man, good. Well, I'm glad you beat it.
Yeah, like I said, to me, it was nothing more than kind of like a hangover. Except for mine's the only thing that scared me about mine is mine affected my right side. It wasn't bilateral. It was strictly on the right-hand side. I had a sinus headache on my right side. My right eye hurt and didn't want to focus right. My neck on the right hurt. The right side of my chest, even my right testicle, not the left one, but just the right one.
Yeah.
So I thought it might be something other than, COVID at first.
Yeah.
But like I said, by Sunday night, my sense of smell was back and everything was fine. I hopped up a couple of loogies. I didn't have a whole lot of coughing or anything else.
Yeah. Well,
keep on going.
Despite all the fear-mongering, most people will not get this thing, and most people who do get it will not die. So even if you have risk factors, I mean, I've seen people with stage 4 cancer get this and just sail right through it.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Really is a lot of host factors. Now,
Right.
one thing I thought would be fun to do, and my definition of fun is different from other people's, but would be to calculate the requirement for herd immunity for Delta variant compared to OG COVID-19.
Yeah.
So if we remember the formula, Dr. Scott, is herd immunity equals 1 minus 1 over the R naught or R sub 0. And the R sub 0 is the effective transmission number, which basically says if you take one person and put them in a vulnerable population, how many people will they infect? That's different than the R sub T, which is the real world, how many people are getting infected by people being infected. But this will give us a number for herd immunity. So if you remember, the R sub 0 for OG COVID-19 was 2.4. So 1 divided by 2.4. And then subtract, that's 0.41, subtract that from 1, and you get about 58%. So herd immunity is attained when you hit 58%. Well, just the other day, we hit 70% in this country.
Yep.
Okay? So, and around here, I hear all this about, the mouth breathers, they don't get vaccinated. That's a bunch of crap. In this area, the vulnerable, and that's over 65 people with diabetes, is right around 80%.
Yep.
That's a pretty good number.
Yeah, we've done well. Yep.
So, it turns out it's the young, for the most part, that are not getting vaccinated because they don't see the value in it. But anyway. So it turns out that the R sub 0 for this virus is anywhere between 5 and 9. I got to pot Stacy down because it sounds like he's unpacking boxes. But so it's between 5 and 9. So let's just say it's 7.
Okay.
So 1 divided by 7 is 0.14, and subtract that from 1, and now you get 86%.
Okay.
So you have to hit 86% of people who are immune before this thing even begins to decrease.
Wow.
Now, all I hear in the media is about cases. So let's just look at cases, because what we're really interested in is hospitalizations. Now, I hear about some hospitals that are getting overwhelmed again. I think a lot of that has to do with staffing, but maybe it is raw numbers. If you're working in a hospital that's overwhelmed, give us a call, 347-766-4323. That's 347-POO-HEAD, and let us know what's going on in your area, because we are not seeing this. And apparently we're where the mouth breathers are. There's nothing wrong with being a mouth breather, by the way. I'm not sure why that's an issue. But anyway, so let's do new cases. We'll do in the United States. And now we are spiking like MFers in this country right now. Okay, I'm looking at the 100-day. Now, so we are, let me get a 7-day rolling average. And I'm doing this, by the way, at covid.stoutlabs.com, stoutlabs.com, covid.stoutlabs.com. So right now we are at the SMA, or the simple moving average, is at 90,000 new cases. Okay, so let's go to when we were at 90,000 new cases before. And that was February 16th. Okay, on the way down from the peak of 249,000 new cases a day. Okay, so but right around February 15th, 16th, somewhere in there. Okay, we were at 90,000. That's the last time that we were there. Now, let's look at new deaths, though, because that's what we're interested in, right?
Right.
New deaths. 386 for the whole country. Now, the last time we were at 386, I can't even go back because when we were at this thing only goes back 300 days. So at October 9th, we were at 484. It was higher than that. So this is the lowest new deaths that we've had since October of 2020. You got me?
Yep.
Okay. So now let's go and let's just do, Stacy, you still with us?
I sure am.
Okay. All right. I just wanted to make sure. So let's go to U.S. data, and what we will do is let's go to New York. We'll do Florida, New York, New Jersey, and Tennessee. How about that? And let's look at new cases. So new cases are about the same everywhere. Now, let's see. Okay, well, Florida is only reporting their data once a week. So Florida had 110,000 new cases. At the same time, New Jersey had 878. New York, 2,400 cases. And Tennessee, 6,800 cases. Now let's look at new hospitalizations. I think we have that on here. No, new deaths. Let's just do new deaths. And if you look at new deaths, we're looking at 7 for New York, 5 for New Jersey, 1 in Tennessee, Florida 409. If we look at deaths per 100,000 population, though, Florida is below New Jersey and New York, and Tennessee is in between. So, I think that's the important thing to look at, is because, again, and I'm starting to sound like a broken record to myself. When we had the pandemic of 2009, that was a pandemic, and we had one of our friends died. We was bury the blade. We had another friend ended up in the hospital with it, which is Richard David Smith, the founder with his wife Shatai of Hyperphysics, the energy drink for nerds. That's HYPERFIZZICS.com. But we didn't shut down. We didn't push small businesses out of business. We didn't pay people more to not work than to work. And it was because the death rate was low. Well, the death rate's low with this. Right now, anyway, it seems to be. Now, maybe it'll go back up, but it seems to me that the vulnerable have been vaccinated. And they're almost at the level where the virus can't be transmitted in that population. So, yes, cases going up like crazy. Deaths, not so much. So we'll see. I may listen to this 2 months from now and go, boy, that was really stupid and short-sighted. But, and there may be other variants out there too. But so far, so good. And what we've said, you and I have both said, if we end up with a variant that escapes all the immunity that we've already generated from this thing, well, it's just a brand new pandemic. We got to start all over again. But it won't be so long for them to get a vaccine out this time.
Right.
They know how to do it, and they've done phase 3 for these vaccines. They really just have to do phase 3 again. They don't have to do phase 1 and phase 2 again, because we're in phase 4 right now with all the vaccines. Post-marketing.
Yep.
So anyway, all right. Well, Stacy, I really hope that you continue to improve. And you said you get out of isolation when?
Next Monday.
Next Monday. Okay, so let me give you something to do in the meantime. Are you ready?
Homework.
Yep.
Talk to me.
what you want to do is get a certificate this is for the world's largest teapot. And the call sign is Whiskey 0 Tango or Whiskey 1 Tango. All of the call areas have one. And then there's Whiskey Victor 8 Hotel Alpha Tango. And if you get all of those, you can get a certificate where you filled up the teapot or you filled up the cup. This is the shit we do in ham radio. It's
mesmerizing.
It's
Indonesia's
Yeah, so see if you can work all of the
next weekend.
Okay, well, see if you can work all of the whiskey, blank tango calls and get that certificate. And you got nothing but time. So,
I got a question for you.
That's just this week, too,
as
by
far
the way.
as the back. Okay. I remember seeing some of those call signs come up.
Yeah.
Who does quality control on the vaccines? Is that an in-house thing?
Yeah.
Because I'm just wondering, what's the chance of this? Because now you've got people having breakthroughs like the senator from South Carolina, Lindsey Graham, just tested positive after being out with a bunch of Democrats on the weekend. And even though claiming that they're fully vaccinated.
Well, here's the thing.
Well, I'm wondering what I'm wondering is what's the chances on a lot of these vaccines just being saline in a bottle?
Oh, I got you. Well, okay, so they have to. You're right. They have to be kept at a proper temperature, although not as low as Pfizer originally. So they got to be handled properly. And but the FDA will pull vials off the shelf and make sure they are what they're supposed to be. And the companies themselves are supposed to be doing that as well. Of course, not everybody trusts the companies any more than they trust, the media and stuff like that. So, but the companies are supposed to be doing that. And really, if the companies get caught, suppressing data that their vaccine has gone bad in the bottle in huge numbers and they didn't do anything about it, I mean, there will be hell to pay. Hell to pay. So, and they know that. Yep. So they're really incentivized to do a good job on that.
Yeah, and can I add too? There are a lot of independent companies that are paid by those big pharma companies to also independently certify that those vaccines
are man, they could be bought off, man.
Well, they sure could, but then they lose their asses too.
Yeah,
and they make a lot of money doing that, by the way.
Yeah, let's not even
talk about getting bought off, because I've got a card that says I'm vaccinated.
But you're not vaccinated?
It cost me $100 bill to get it.
Listen. I mean, I'm just saying that, in my opinion, is I don't care if you don't want to get vaccinated. I mean, that's up to you. It is you may be a burden to society, but I'm willing to take that on. But then to turn around and have a fake just card. Say you didn't get vaccinated and own it. Why not?
Because of my job, and you knew where I was supposed to be going to.
God, you're not going to get in trouble for this. I don't want you to get in trouble for this.
Oh no! Well, the job's not happening now. But yeah, we were all supposed to be vaccinated with proof of vaccination.
Okay.
So I signed up for a little place to go get a vaccination. I walked in with a water bottle and $100 bill, and she came in there with a syringe laying on a tray. And I said, "Let me see this thing. This is the magical thing." I pulled the cap off of it, shot it in the water bottle, gave her a $100 bill, said, "I need that card."
Jeez. Oh my God!
Prove me otherwise.
Are you sure Are you sure it's okay for you to tell that story? I don't mind running this back.
Nobody. Well, the only way that you're going to prove that I'm wrong.
Well, I'm not going to prove anything.
Down, pull blood out of me and test me.
Yeah.
But yeah.
I've
got several guys that
he could just be telling a story.
$100 bill to get a card.
Oh yeah. Well, that is the vulnerability of this thing when they're saying, "Oh, you've got to have a card to go to these concerts and all this kind of stuff," and yeah, you will have people doing that. And they're not doing titers on people before they go into a concert, so you'll have lots of people running around saying they. Now, I heard of somebody. Wasn't there somebody recently, Scott? Check this out.
Okay.
This is something for you to search. I think somebody got on a plane or something in another country and said that they had a COVID vaccine, showed a card, and it turned out to be fake, and they got in all kinds of trouble for it. Do you know what? Do you know the story, Stacy?
I've heard the story, and I heard the story today about on Fox News. They're talking about the fear of people mass producing fake cards, but at the same time, the Foo Fighters had done multiple shows in New York, and the only way you could get in was to show your papers, your vaccination card, and then half the band from the Foo Fighters came down and tested positive.
Oh, my goodness.
Yay. Great vaccine.
Oh, my God. Okay, here we go. 2 travelers who used fake vaccine cards to enter Canada from the U.S. were fined nearly $16,000. The airline passengers also submitted fraudulent test results. I wonder how they found out. Let's see what they say. The passengers failed to stay at government-authorized accommodations, also required by the country's government. Passengers who were not identified in a news release traveled to Toronto 2 weeks ago and were Canadian citizens. Okay, phew, it wasn't one of our friends from Sirius XM 103. They were fined 20,000 Canadian dollars. Let me see. Oh, they say they did not say how the fraudulent documents were identified. Oh, boy. Oh, boy.
Interesting.
Mine's not a fraudulent. That's a real one.
Yeah, right. It's a real card. Oh, my goodness.
Yeah.
Okay. Okay, here we go. In July, the Department of Justice announced the arrest of a naturopathic doctor in Northern California who allegedly gave patients false vaccine cards and homeopathic remedies. Sounds familiar. That said she would boost the body's immune response to the disease. That sounds like old Stacy. Is this who you went to? According to the complaint filed in Northern California Federal District Court, the cards allegedly provided by the doctor, Julie Mazzi, falsely said the patients had been inoculated with the Moderna vaccine. Yeah, if you're just own it.
Well, just don't.
If you're going to just do natural things, just own it. Say I gave them, natural remedies.
Yeah.
But
don't say you're curing anything.
Blind squirrel dung or something.
Exactly.
Well, that's right. But, if when Scott gives people flying squirrel gun, he doesn't say it's losartan.
Right.
He says it's flying squirrel dung.
Yeah, I told him it's squirrel feces.
He's willing to stand by what he's doing. When you give people saline or whatever she gave them and then said it was the Moderna vaccine, it means one of two things: that you don't stand by what you were doing, or number two, you just did it for the money.
Mm-hmm.
Because people wouldn't come to you unless you would give them, some people wouldn't. Probably more people wouldn't come to you if you gave them. And now, all of this is allegedly, all right? It's, we don't know. I'm just saying what she was charged with and what they're saying she did. But anyway, all right.
Interesting.
And I'm only reading her name because it was on NBC News. On a story by Tim Stello, so if you're mad at anybody, be mad at him. But anyway, all right. Good Lord. What a world we live in.
That's insane, isn't it?
We definitely live in interesting times, do we not?
Man. Yeah,
we do.
I think the Internet's a big part of it.
I think it's a huge part of it.
I think it's to blame. I'm really starting to think that. Oh, well, what are you going to do?
Oh, my God.
As a libertarian, I don't want them coercing people to do anything, but it's okay to make your case and let people make their own decision. And so far, they've made good decisions for the most part. I mean, we got 70% of the country is vaccinated, 80+% of people in our area that are vulnerable have been vaccinated.
That's right.
And now somebody was asking me. I was going to play. I've got to play your question too, and we only have a few minutes left. But this is one of the best questions Stacy has ever called in.
Uh-oh.
Let me just
down.
go ahead and play it.
Dr. Steve, Dr. Scott,
Hey.
This is Stacy DeLoach.
Yeah, no shit.
DA, also, that's my official title for dumbass, because everybody else gets to have a title. Anyway,
well, we have a new reason for calling you that, but we'll get back to that.
Question for you. Cremation.
Yes.
If a female is cremated and she has breast implants.
Yes.
Silicone is one of the strongest materials and almost indestructible. Would those survive being cremated?
Okay, so I did some research on this. This may be your best question because it's got everything in it. It's got boobs. It's got, hey, I don't know the answer to that kind of stuff for the listener, and they're all fascinated and want to know the answer. The answer is when they do these, if they do not remove the breast implants, they will, ladies and gentlemen, explode. And when they explode, the silicone does not, just like Stacy said, it doesn't incinerate fully, and so it coats the inside of the crematorium with this sticky, nasty, silicone substance, like caulk.
Yep.
Right. So,
I bet the first person that figured it out the hard way.
Yeah, they figured it out the hard way. That's right. That's right. So what they do is they remove them.
Yeah, sure.
And then they cremate the body. Now, if you want them buried with the person, then they got to get a super special giant urn to do that, so they can cram them in there on top or below the ashes, or they could sandwich them. Put one implant on the bottom, put the ashes, put the other implant on the top. But the answer is they remove them before they do that for that exact reason. So it was a very good question.
Great question.
Yep.
Thank you. Thank you very much.
So there you go. Yep. Very interesting. All right. Well, listen, man. I hope you get better. They're saying you got to go. So, so take care, man, and keep us in the loop.
I will. Y'all be careful.
Okay, buddy.
Take care, Stace.
Okay, bye.
Okay, buddy. Be back.
All right. Good Lord.
Jeez Louise, what a hot mess. The Hot Mess Express.
Well, I mean, I understand it.
Too many diesel fumes, I think, is getting to his brain.
I understand the thinking. Let me put it that way.
Yeah.
I understand the thinking behind it. I don't understand the ethics of it.
Mm-hmm. And I think that's the whole thing, is that as long as we all just hear what the other person is saying and appreciate it for their differences, then this thing could be a whole lot easier to tolerate.
Well, and that's true of both sides of this.
Sides, yes.
And what kills me is we used to just have a continuum. We don't really have a continuum anymore. We've just got two sides to this.
Right.
And the one side, I was on a podcast today, and the guy said, "Why did you vote for Trump twice?" And I was like, "Oh, no, wait a minute. This is how you open?"
Oh my God!
I said, "Did I do that?" And he said, "Well, that's what our records show." And it's like, "What records? Get the hell out of here! I'm a libertarian. I voted for Serene Ardilianu, along with probably 1,000 other people, but I don't care. I voted my conscience."
Right.
But
interesting.
Yeah.
I think it's because she tweeted you, or she retweeted one of your tweets. Probably that's why you.
Yes,
voted for.
of course, of course. And I want to be her vice presidential running mate next time. That would be so much fun. I love her.
Cool. That'd be pretty cool.
So
We'd vote for you.
We had her on the show. I don't think you were here that day.
No, I wasn't invited.
And you don't listen.
You invite me when you have the.
You're here. Shut up.
The talk on ham radios and.
All right. Okay, let's take another call before we get out of here. And let me.
Number one thing: don't take advice from some asshole on the radio.
All right, very good. Let's see here. I've got. This one's pretty good.
Hey, Dr. Steve. Thinking about this Delta variant being, more virulent but less fatal, less.
I don't know if that's true, but yeah,
and
most viruses.
Thinking about how
that.
the perfect evolutionary, pressure for a virus is to become easier to transmit and less disruptive to the host. Are there any viruses that we just don't even know about
Yep.
because we pass them back and forth so easily but they don't cause us any problems at all?
God, that's such a good question. Yeah, the so-called non-pathogenic viruses. And these are viruses that have decided to settle. Because here's the thing. The reason you cough, it's not the reason you cough. That's teleological. I'm assigning meaning where there is none. But viruses that cause you to cough are more easily transmitted if they're respiratory viruses.
Okay.
Because if I'm just breathing normally, I'm not going to shed that much virus.
Right.
So some viruses will have strong natural selection pressure to enhance their ability to be transmitted from one person to another. Now, if they kill the host too fast, it selects against that because then they can't transmit very well.
Right.
If they invade the host and then are stuck there, they can't transmit themselves either. So how would a virus get from one person to the other? Well, some of them we get at birth and then they just live in our body. That can happen. You can get exposed to them once and they just live there.
Mm-hmm.
Herpes, chickenpox is kind of an example of that, where you get the chickenpox and then it lives in your body, and not everybody gets shingles.
No.
But it's there and it doesn't cause any symptoms. Of course, you can't transmit it to anybody anymore. But it had its one sort of flash in the pan.
It had its heyday.
And it was really transmissible. Chickenpox, very transmissible. Ooh. So it was very transmissible up front and then just lives in the body. Mm-hmm. I read there are viruses that attack bacteria. And there are so many bacteria in your colon that your colon is probably full of bacteriopathic viruses. I may have just made that word up, but they are pathogenic. In other words, they invade and infect the bacteria. Look at bacteriophage, by the way. That's one of the craziest things. Look at electron microscope bacteriophage. Well, I'm telling you have.
Oh, no, I'm sorry.
I'm telling our listeners.
I thought you were telling me to
it's
look
not
it
just
up,
you and me here.
No.
But those are really cool little machines. They look like little alien machines.
Yeah, with a special little dart on the bottom.
Yeah.
That's
And
cool,
these little legs, and they inject their DNA into the bacteria. And those things are all in your body. And yes, some people would say, well, you're infected by them. You're not. They inhabit your body, but they don't target human cells at all.
Mm-hmm.
But there's billions of them in your gut right now, most likely.
Yeah, I was thinking the same thing.
Just reproducing on the bacteria that are in there, and there aren't enough bacteria for them to infect them all.
Mm-hmm.
There aren't enough viruses there to infect them all. The number of bacteria in your gut is in the trillions, maybe more than that.
Interesting.
So that's pretty cool. Yeah, that's a great question. But it is very difficult for a pathogenic virus to evolve to the point where you no longer have any way to transmit it to somebody else. It can happen. Anyway, all right, let's see if we got time for this.
Yeah, this is Wade from Louisiana.
Hey, man.
I've been hearing a lot about people that contract COVID-19 that have already been vaccinated. I have myself been vaccinated, but I'm wondering if people are just confused how a vaccine works. The way I view it, and I need to be corrected if I'm wrong, but it's not a shield to protect you from the virus. It is a mechanism to keep you from suffering from the virus.
Sorry, Wade. Yes and no. So when you have humoral immunity, those are antibodies, and you got a ton of them, you're less likely to get infected. But as that fades, which the coronavirus does, measles, not so much. Tetanus fades over 10 years, maybe. I mean, we get boosters every 10 years. Pertussis kind of fades over time. But things like measles and tetanus, things that have long-acting antibodies, I mean, they're just always circulating. You can detect them. those things will pretty much protect you from being infected. Now, when they decline, as the coronavirus antibodies do, for whatever reason, we don't know why the body doesn't keep producing antibodies. Maybe it's because they change so often that the body just says, "Oh, fuck it."
Yeah,
It's stupid for us to have a clog up that works with all these antibodies. We'll just wait till the next one. But you will still have humoral response, and the humoral response are the cells, the T cells, memory T cells, macrophages, all these things, killer T cells that will induce the body to fight these viruses later. So when the antibodies fall, you can get infected now. It's a lot easier to get infected, but yes, you will be less likely to die if the humoral immunity works.
Okay.
Or less likely to progress to advanced disease, which was always my hypothesis about this coronavirus. We have other coronaviruses in the population, and all they do is cause the common cold. And I think that those are ones that we have developed immunity to in the very young age. And just as we see kids don't seem to be affected by this virus, and then as you bring that immunity forward, you have humoral immunity, you'll still get infected by those viruses, but now they just cause the common cold. And I think this one will do this too, but it'll be a generation from now.
Okay.
We all need, the old folk need to die out, and then the kids that got immune to this need to have children. And then when that happens, this virus will still be in the population, but they'll just get colds from it.
Right. Yeah.
Because all the old people that have never been exposed to it before will be dead by then.
Then it'll be a coronavirus like the rest of the
other.
Yeah,
It'll be number 6.
Yeah.
It'll just be number 6.
Yep.
All right. Very good, Wayne.
Good job, Wade.
Yeah. Let me see. I don't know that we've got time for this. Yeah, we do.
Hey, Dr. Steve. Calling about your opinion on low-level laser therapy for back problems.
Yeah.
I am a mid-50s male, very fit condition, but every once in a while I will throw out my back, and it's not spinal, it's all muscular.
Yeah, okay, understood. So he's interested in low-level laser therapy because you can buy that.
Sure.
Do you we don't have much time. Do you do any of that?
No.
Okay.
No.
Yeah. So I looked this up in the Cochrane reviews. This is where they take all the data and mush it together and then give us an answer to the best of their ability. And it's very well respected journal. And they said low-level laser therapy is used by some physiotherapists to treat low back pain. It's non-invasive light source treatment, generates a single wavelength of light, emits no heat, no sound or vibration. It's also called photobiology or biostimulation. And it was believed to affect the function of connective tissue cells and accelerate connective tissue repair and act as an anti-inflammatory agent. So they included 7 studies, but it was only a total of 384 people. It has not been very well studied with non-specific low back pain. 3 studies separately showed that this low-level laser therapy was more effective at reducing pain in the short term, less than 3 months, and intermediate term, 6 months, than sham lasers were.
Cool.
Okay. However, the strength and number of the treatments were varied. The amount of the pain reduction was small. 3 separate studies reported that that was no better than exercise alone. So the jury is still out. So, I mean, you don't do any of this stuff?
Not really. I've certainly seen it, and I know
it's not really acupuncture. It's not traditional Chinese either, but
it's not, I've seen people do what they call laser acupuncture. So instead of doing the insertion, they also do this laser acupuncture, which I've never seen anybody that did well with it.
Yeah.
But I've also seen, and conversely, I've seen some folks that had the laser done on their dogs for arthritic knees. That had
I know,
and spine. So I'm not saying I'm not against it at all. And certainly if I had back pain, I'll try any damn thing.
Basically what Cochrane said was based on these small trials with different populations, low-level laser treatment doses and comparison groups, there are insufficient data to either support or refute the effectiveness for the treatment. So they're not saying it doesn't work.
Yeah. Yep.
They're just saying the data sucks.
Yep.
It says we were unable to determine optimal dose, application techniques, or length of treatment with the available evidence. Larger trials that look specifically at these questions are required. And that's always true. Mm-hmm. We need large, double-blind, placebo-controlled
Dr. C, what I would say
randomized trials.
Yeah, I didn't mean to interrupt.
No.
Yeah, I was just going to say what I would say is if it's not going to hurt you and you want to try it.
Yeah, I don't have a problem with it. It certainly will not cause any harm unless you're avoiding doing something that you shouldn't.
And I'll say this too: if all it does is warm up the muscle and increases blood flow, that might give a little bit of benefit. Who knows?
I just wonder how it would do that. But anyway.
I don't know.
All right. Well, listen. Thanks always go to Dr. Scott. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, Roland Campos, Sister of Chris, Sam Roberts, She Who Owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Steve Tucci, the great Rob Bartlett, Vicks Nether Fluids, Casey's Wet T-shirt, Carl's Deviated Septum, Bernie and Sid, Martha from Arkansas's daughter, Ron Bennington and Fez Watley, who's supported this show, has never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Scott.
Thank you.